Welcome to Access Amplified, the podcast where we shine a light on how digital health is increasing access to care and advancing equity around the world. I'm your host, Joanna Brownold, and our podcast is brought to you by Taito Care. In each episode, we sit down with healthcare leaders who are doing the work, not just reimagining access, but rebuilding it from the ground up. And today I'm joined by Ivelyse Andino, founder and CEO of Radical Health, a public benefit corporation working at the intersection of community, technology, and equity. Thank you so much for joining me today, Ivelyse.
Thank you so much for having me.
In this conversation, we're going to unpack how Radical Health is using digital tools and trusted relationships to help people build agency, to ask better questions, and really to navigate care with confidence. And I'm really excited to dive in. And I want to start with Radical Health's origin story. So you have said to me before that the healthcare system wasn't built for people like you, and so you wanted to build something different. Can you take us back to the beginning and tell us a little bit about what led you to create Radical Health?
Of course. It's interesting because I don't think the healthcare system, the modern day healthcare system, was built for any of us. Specifically, when I look at my story, I remember the background is my mom was diagnosed with cancer really unexpectedly in my very early 20s. And if you've ever visited loved one in the hospital, or had that experience. I remember vividly walking in to down the corridor, lights and beeps. And I walk into my mom's room and she had great nurses and great care, but she was really disoriented. It was after a long day of work. So I'm sure I'm like in my heels that were really uncomfortable. And I, could feel the weight of the world on my shoulders. And so I'm trying to talk to my mom, trying to understand what's happening. And she just wasn't coherent, like, really couldn't make sense, and so I did what was normal. I went to the nurse and I said, "Hey, something's wrong, this isn't happening," and it was during shift change, so the nurse who was there really couldn't pay attention to me. I went to the front desk, I grabbed, a resident walking down the hall, and I'm like, "Can you help me with my mom?" And no one really paid attention. And it wasn't until one of the nurses who had been there during the day had already kind of shifted out, but she said, "Oh, I know your mom, and you're right, something's wrong." Turns out, her electrolytes her potassium levels were too high, and just had really was just a miss in that moment.
Uh-huh.
But it was in that moment that I really came to this realization of, "Ooh, like, I'm pretty smart." My mom also worked in healthcare. We had the tools, we had built the relationships, um, but I didn't know how to navigate that. I felt really lonely, I felt really scared, and so that was one of the awakening moments for me that led me to believe, and there were many more in my journey of trying to get into med school and be a doctor and told that I couldn't, and beyond that, having my son and feeling similar experiences of not being able to get what I needed, and so the idea about radical health really came to this core feeling of, like, you don't have to health alone. That in that moment as a young person trying to support my mom, even for the nurses and the clinicians and the doctors who were working, oftentimes were alone in this moment, and so radical health began with that idea, those moments, that feelings that I didn't want anyone to experience what I experienced of having to figure this out and call and frantically put the pieces together. And, today we get to support people through their healthcare journey using conversations, using our online community, help people know, what to ask, how to ask it, and support clinicians and train, and do workshops and leadership development for the next generation of healthcare professionals who really, right, want to center community and experiences and make sure that no one's going through this alone.
I think that's really special because I think many of us would have similar stories, to a greater or lesser degree. And I certainly did not, have a similar experience and then get up and found a company to solve the problem. So thank you on behalf of all of us. And I do want to talk a little bit about, you mentioned just now your platform. And I know that you've recently kind of redeveloped that, and that's been a whole journey in and of itself. So can you tell me a little bit about kind of how you built the original app, what changed, how you shifted? Because I think that that is a really good representation of the work that you're trying to do as well.
Yeah, this was, when I started Radical Health, I had come from a health tech background. So we created Previously, I was one of the founding teams that created an app platform that prescribed apps to patients. So in starting this, I already knew. I said, we're going to build out this really cool app. It's going to be on the Apple store and the Android store, and people are just going to get it. It's going to be in their watches. And very quickly, I was like, oh, actually, the people that we're working for, we design for the folks who may not have ever had a primary care physician, maybe never used a digital health solution. And so I got really smart and really it was really wisdom from other folks, and started doing these circles. So listening to people sitting around, and this is kind of the core of our business now, these circles where we sit with folks and ask them what do you want? What would you use? And after many of those conversations, we still built the app because there's a business in place that tells you you still have to do these things. And we found really, really quickly that for the many people who we were working with, like they didn't have space on their phone to download an extra app. The storage really was an issue. Some of their data plans, and again, we've been building this for about 9 years, early on, the data plans are expensive. Some people share a device with their family. So there's one device that, many people are using. And
Okay.
that when we're talking about healthcare and privacy, right, that's not ideal. And so what we did was we really had to reimagine how we were using technology and how that was meeting the needs of the communities that we wanted to serve. We I think you often look at like engagement, and many of us in digital health obsess over like, what is the engagement? And we had to pivot really to removing barriers and what does like access look like. So we scrapped the native app, we got rid of everything and actually simplified our tech down to what people actually want to use. So web based. In fact, now, which is new for this year, we're going back to more some in person connections. People have been yearning for real people touch
Mhm.
points. So combining our tech with the actual community kind of social hubs that people want.
And that hybrid approach, so you've got like your digital tools, you've got real world, this community-based dialogue. How are you pairing those together? How does that work in practice? And what does that look like for your customer, for your user?
Yeah. So it's such a good, we look at it as right, like we're not designing for our people, we're designing with them. So when we combine both platform, our community, that's available 24/7. Folks can log on, sign up, connect with others, join an online circle. So the ability to connect is still there no matter where you are geographically, no matter where you are time wise. That part is always there. But then what we found is that there's really a need for locally based connections. And so what we've started doing is we have monthly, sometimes bi-monthly events right now, focused in New York City, but we've been getting a lot of interest around town, different states to host what we call the recharge room, and where people are coming together, they're sharing stories, their know-hows, their hacks, but also getting to sit with providers, and have social connection outside of the clinic, outside of the emergency room. It really is, beautiful when we see it happen because oftentimes, right, high pressure, high stakes, you don't get to ask the things that you want. And also for clinicians who are incredibly burnt out, who are really overworked, but also don't get to practice the way that they want to, the way that they're licensed, right? The way that probably they got into this business to do. It allows for a really cool exchange. And, the way that that always works is that whether it's in the conversations or the in-person gatherings, we're connecting back to resources. We're connecting back to clinics, primary care physicians. We connect back to the resources that get your drugs discounted, connecting back to, if you're uninsured, what would that look like? So, really making sure that we use our digital tools to open the doors. And then people are literally walking because we're still an in person kind of healthcare system. But then people are taking that to walk through those doors to take what they need. And we just kind of are plugging in, we call like, our trust is our API. So wherever we are online, we're building trust in person and making sure that those things are connecting.
I love that. And I feel like it's kind of taking it back to like the old school days where we would live in smaller communities and there would be a local doctor and we would see them in the grocery store. And many of us don't have that anymore. And especially in many of the underserved communities or the overlooked communities, they don't necessarily have that opportunity to connect on a personal level with a clinician, maybe only on that kind of emergency level. I do have a follow up question. Are you seeing different points being raised when you're dealing with the local groups in New York or different cities across or different areas across the country? Because I'm kind of wondering if there are the similar problems being raised or if different communities are really having very different experiences.
We often say that, like, the definition of health and everyone's journey really is like the most agile variable you can find. My definition of health today is very different than mine 10 years ago. It's very different than yours. And literally, after we record this, I could step outside and take a wrong turn, and my ankle now is the thing that I'm focused on. And so, what we see is that every community has a different need. And it changes given policies, given experiences, given environmental impacts. A large part of our health really is determined by where we live, our zip codes, right? So whether there's a new plant being built and you have emissions or, water is being tainted. Like these are the things that determine our health. So no matter where we go, our health is always and our communities are raising different concerns.
Mm-hmm.
Um, and I think that's the for many organizations, and I think for many companies, that's the tricky part, is how do you respond, right, to the needs when we are in a kind of global healthcare system that really is looking at a standard and one way of treating everyone, and we just know that that doesn't work.
Yeah. Yeah. So, I mean, I guess one of the questions that I was going to kind of dive into a bit later, but maybe we'll go into it now is just around how health systems can learn from the work that you're doing because I know that many of your users are relying on the ER as their primary care. That's a massive challenge. There's opportunities there. And a lot of health systems are trying to work to improve that, improve the system. And how can they learn from what you're doing and how can they start building equity as well into their strategies?
Yeah, I mean, I think, from a human perspective, for anyone who's hearing this, like, there really, is no shame in using the emergency room as
Right.
your primary care, and I think that that is for many people, that's the only care that they can get that is guaranteed, that they
Uh-huh.
know they're gonna be taken care of, they won't be turned away, and so to name that, oftentimes that's also not really a choice, that's just a structure and what it's going to be.
Uh-huh.
Um, and I think that when we start with that, right, I also think there's a grace in there and an understanding that as much as we wanna, for business incentives, drive people to other options, for many, that's just what it is, that's what it is. So when we think about how and what healthcare systems can learn from our work, I mean, I think, big picture is we need to stop, penalizing and judging the high utilizers of the emergency room, but really get to the why are they there? Uh, Sometimes it's just, again, access, being there, reliability, trauma, right? Some of the experiences that people have had,
Uh-huh.
but really get to an understanding of why are people here. I think the other thing that healthcare systems can learn is for many people, they just need like extra support to know, right? This is the trust piece. So, where are we having community supports? Where do we have community navigators? Where are people actually spending time to share
Uh-huh.
their fears and their concerns? I know before we started recording, there was a moment of like connection to say, this is what we're carrying. This is what it looks like. And in our worlds, wherever we are, that pocket of human space often doesn't exist. So for healthcare systems, where we can invest in those connection points, in those anchor points that build trust, that really is strategic in my opinion and needs to be treated as such and not just as like a charity or as an afterthought. And then I think there's a world in which how are we measuring outcomes that happen beyond the clinical care? It's one thing to say we want to reduce diabetes or we want to, reduce falls. And those things are incredibly important into naming the quality. But I think that there are a lot of other outcomes that need to be measured. So again, where are people going? Why aren't they showing up to scheduled appointments? Who are the trusted pieces. And there are a number of other measures. What do people do instead of coming to get care? That I think once we start to measure those pieces, we start to then look at other alternatives. And, there are many places of innovation, many states that are working on redesigning their Medicaid to include, free air conditioners, right? Things that
Hmm.
actually impact people's home, their life, and their care. But I think that, like, really for healthcare systems, we need to design for the instability that many people experience, and design for, like, that stability and the wraparound support, because that's where everyone is most of their time.
Yeah. Yeah, that makes a lot of sense. And I think, I've spoken with quite a lot of health systems who are working on SDOH factors as part of their strategy, not as you said, not as like a nice charity so that we can, I guess, look good or feel good about ourselves, but as an integral part of their strategy, and then measuring that again to try and understand how that's then impacting the business and also the people, which at the end of the day are what we're here to help. I wanted to. We kind of started speaking a little bit about your app, your web based platform now, and I know that you have a lot of experience when it comes to digital health and what community led design might look like. And I'd love to hear your take on that, how you approach that at Radical Health, and any advice you have, especially for those who are trying to reach people who have been excluded from traditional care models. How do we include them?
Yes. I think this is a really good question. I get asked this a lot. And I think, one of the things is just the name, right? Who's building? Who has the time, the energy, the resources? Who is building, and to what end? We joked a little bit about, I saw this problem and I built this company. And let me tell you, it was not an easy route.
No, I didn't mean to make it sound like it was.
More than that, it wasn't easy, but also an incredible privilege that I have to be able to do that, to be able to leave a job and start a company without any guarantee. So, both really hard, but also a privilege. And so when we think about who's building, right, that's just one piece. And I think it's always worth, no matter who you are, where you are, just name that, to think about it. What are we doing? Then there's, like, what does the invitation or access look like to build with community or to have community led design embedded in some of the work? Most people who are going to be impacted and or users really don't have the opportunity to advise, don't have that. So I think wherever there is a space to really build in feedback, to really build in, and to invite in advisors the same way we would on a board or, in any role, that part is always going to be helpful. I think that for us at Radical Health, we pay our community, we hire them to do work as co-designers, as advisors. So when we're rolling out new features, when we want to test things out, we really invite folks in to be our partners. This is, across the industry, there are ways to do this. For us, also, we have a unique approach where, we test in people's living rooms, we test in real life, solutions, not just like convene focus groups and conference rooms.
Mm-hmm.
A little unconventional, but really, where people are, is where we go. And then, I think there's something for everyone who's like, well, we've got some of that. It's really important to, like, ask, who's not here? Who are we missing? What would it take to invite them in, to center them, and to make sure that they, belong? There's a lot of I have to, like, the truth is that, like, it's maybe not always the fastest route to do all of these things. You might not always see the business kind of pay off at the front end. But I will say this, it is paid off for us infinitely in terms of who we build for, the niche of consumers that and patients that we're able to work with. And it really becomes this, like, smarter strategic play because we're really building something that people want to use, they need to use. And for many of our, partners in this space, we have the patient population that they, would really or want to serve, and don't know how. And so I think that there is really a big invitation, and this could be across communities, really a good opportunity for many companies to adopt this.
Yeah. Yeah. I'm almost picturing, like, obviously we all companies are with their board of directors at the top. I'm almost kind of picturing like a board of the people I don't want to say at the bottom because, but like in the same way as in this giving the same amount of input. And you said something really powerful in our prep call that kind of really stuck with me. Which was, I'm going to quote you to you, this isn't a failure of compassion, it's a failure of the industry. Tell me, really, I just wanted you to say it now on the podcast so that everyone else can hear it out of your mouth instead of out of mine. But tell me a little bit about what you meant by that, and what does it really take to shift those incentives so that equity isn't the exception. It should be the default when we're designing.
Yes. Thank you for quoting me to me. I think that, we hear from my standpoint, right? The healthcare system today is broken. No matter where you are, it just really doesn't really work. It is a bipartisan issue. So regardless of what party you're on, that is, I think, where that quote came from. That what we're seeing really is not, it's a failure of the industry as a whole, but not of the compassion and the care of individuals. I've never met a clinician that didn't care deeply, right, about the work and about patients. I don't know about you, but I wouldn't commit a lifetime of education, here in the US, a lifetime of debt to
Yes.
get into an industry that I'm overworked, compassion fatigued. I'm seeing a lot of pain and hurt, and it's my job to fix it. So I don't think it comes from the clinician side. They care deeply, but the incentives are broken, right? The We're paid for procedures. The way the structures work, but we don't have payment codes, right? For connection, for how do you get an appeal, right, to a claim that was denied?
Mm-hmm.
We're and I'll take it even further. We with the age of AI, we're using AI in many places to automate things and automate the harm that already exists. So I
Exists.
think
Yeah.
that this is ultimately people care, which is I think why we're up in arms, why it's really a main point of all the conversations. And I think there's a matter of like how and what do we do about it?
Mm-hmm.
Right now, there's someone in an emergency room who's sitting there with a treatable condition, who's gone, 8 times, who's not being heard, and they're waiting. And it's not because the patient didn't care, it's not because the doctor didn't care, it's because for some reason there's some code, something that got denied.
Yep.
Things are happening in that way. And so when we think about what comes next and what needs to shift, we really have to imagine a future. And I know this is really hard because we only know what we know, but really imagine a world in which our clinicians and our communities and we can operate like humans, operate in that compassion rather than in the system that tells us, this is how we do things in 5 minutes and attach it to a code so that we can all get paid.
Mm-hmm. Actually, it's interesting that you kind of raised that. What one of our partners, and she spoke on one of the episodes a couple of months ago in Waianae Coast in Hawaii. They actually set up their own coding system, and they set it up to support patients who didn't have access to internet. Why didn't they have access to internet? So they set up a coding system that allowed the clinicians who were connecting with the patients to easily document where the problems were, not on the medical side, but on the connectivity side, the healthcare, the equity side, the access side, so that they could then address those as a group and as a whole for the whole community. And they've been doing that for nearly 20 years now. I think it might even be longer. And so they've got years of data around this. And then they work to help improve the system for the whole community, which is just an amazing way to approach it.
That's brilliant. I'm curious who fought to get it done, how they got it done. But that is, when we start to look at designing for community, for inclusion, for belonging, and for change, right? These are small things, however you look at them, but that give us what we need to think about a future that's not just based on, you know, how much money can we raise, how much money can we make, our shareholders, our board, but really start to think and to document that for all of us, our health is not just a prescription that we get. It's how we love, how we connect, right? How we go through loss. It's, who do we call when we're down and who do we call when we're up to celebrate? Um, and I think that these moments, these times that we're in are really calling us into a more human world, into a more humane experience. And it would, I think, be the wisest thing. And I think we're almost at an inflection point where our healthcare system has to shift. It has to meet where we are as a people. Has to.
Mhm. Yeah. And looking ahead, I kind of want to hear, one, what are you hopeful? What keeps you inspired? And also, what are you the most proud, like, about what you're working on now and what you've worked in? What is your biggest achievement that you're the most proud of? And what gives you hope and keeps you inspired?
Yeah, that's such a good question. What's giving me hope is, every day we get to see one community leaders, right, emerging. They might not have defined themselves as a leader, but they are people who are using what they've lived through and what they're going through really as a catalyst, right, to make sure that no one else has to experience it in the same way that they did. So we see folks leading circles, supporting one another through their healthcare journeys, whether it's what happens with a drug overdose when you witness that, or supporting people just to find a therapist and understand their mental health and how to take care of that. So that for me gives me the most hope is that regardless of where we are, people are still turning to one another and helping each other. But what I'm most proud of is that 98% of the folks that we work with at Radical Health feel more connected. They are feeling that after they engage with us, that they are not alone. That's the number one comment that comes up in our surveys is it's usually, I thought I was alone in this, but I'm realizing so many other people are going through the same thing. Like
Wow.
that, a variation of that comment comes up every single session that we have every single day. And when I look at that, for us, like that's just not like that's not tech, that's not a health tech, that is literal belonging. It
Yeah.
is
It's just human
stand up
connection.
right, and, I don't know where that goes on an investor deck, but I will say that that is, for me, what I'm the proudest of, that I started talking about my own journey and, like, I remember, again, walking down the hospital hallway, and each step and my shoes clacking felt like, I'm like, "I don't know what to do," and the fact that somebody can not feel that same dread that I felt makes a big difference. And then, when I think about the biggest or where we're going, I'm just like, this is the moment. And it is an invitation. It is for a long time I felt like I was the only one talking about, a radical healthcare system, a humanity in this process that is very inhumane at times. And I think that we are really there's so many folks. I'm grateful to you, Joanna, and to Title Care for even allowing this conversation to happen because here we are and we're taking steps, we're doing things differently. So I'm really, really hopeful and excited and proud of the moment that we're at, but also the invitation that we get to like take this so much more further.
Yeah, absolutely. And I'm inspired by your message of hope. And yeah, hopefully you're right. And that's where we're going. And I really hope that that is the case and a positive end to our conversation. Thank you so much for joining me today. It's, as always, a pleasure speaking with you.
Oh, I feel the same way. Thank you so much. An incredible joy to be here.
Thank you. For everyone else, if you did enjoy today's conversation, please be sure to follow or subscribe wherever you get your podcasts. New episodes drop every 2 weeks. So please share this episode with a colleague who's passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by Taito Care. I'm Joanna Brownold. Thank you so much for listening, and we'll see you next time. Where is my stop button gone?